Hello, another exciting renovation taking place in hair restoration surgery. What am I talking about? I'm talking about micrografting dermopapilla cells into areas that are starting to go bald. The process is called REGENERA. REGENERA is a technology that was developed in Italy about 2.5 years ago. And essentially what it does is it takes a couple of hair follicles from the back of the head. We run those hair follicles through the machine that REGENERA has invented. And this machine separates the hair follicles without injuring them and puts them into a solution that can then be injected into another part of the patient's scalp. We learned about 5 or 6 years ago that dermopapilla cells migrate. They migrate in and out of the dermopapilla of the scalp hairs. We've seen that in both laboratory animals, and we've now demonstrated that in humans as well. And so it makes all the sense in the world that if we wanted to take a dermopapilla cell or dermopapilla for a hair that's destined to go bald, that's programmed to go bald because it's sensitive to the male hormone DHT, and if we can add some dermopapilla cells to that hair follicle that are from a hair follicle that is not destined to go bald, it makes sense that that may be able to reverse the process. And so over the last 2 years, 2.5 years, we have been studying, does this process really work? I brought REGENERA into the office about 15 months ago, and I've been very excited about the results I've seen with the patients that we've done it on. We're using REGENERA predominantly in the back of the scalp, where is the crown baldness. And we've been injecting the areas before they go bald, when the hair is miniaturized. Again, it won't grow hair where there is none. It's not like a hair transplant where you can plant the whole bulb and it'll grow in totally bald skin. But this is where the miniaturized hairs are, where it's destined to go bald. We use the REGENERA in that area to reverse the balding process. And I would say that probably we've done it now in about 60 patients, and I believe that we're pretty close to seeing a positive response in about 40 or 45 of those people. So at least two-thirds of the patients that we're doing this with have had a positive response and have been reversing or stabilizing the hair loss in the back of their head. So I'm real excited about the technology. I think it has a lot of promise. And quite frankly, I think that it makes the most sense of all the technologies that have come to the forefront in the recent past. The exosome technology, which is very non-specific for hair. The PRP technology, which is very non-specific for hair. Here, we're actually isolating dermopapilla cells from hair follicles that are destined not to go bald, and relocating those dermopapilla cells into the area where hair follicles are that are destined to go bald. And these dermopapilla cells are migrating into those bulbs and reversing the process. Now, with all the other technologies that are medical interventions, permanency has not ever been proven. And we know that PRP treatments need to be repeated if they're positive. And we know that exosome treatments need to be repeated if they're positive. And we know that Propecia, finasteride, minoxidil therapy has to be continued. We do not know for sure how often this REGENERA treatment is going to need to be repeated. We suspect that the end result may only last a year or two. I've been doing it now for about 16, 17 months, And I can say with confidence, I've not seen any patients yet that we think we need to retreat. So I'm not suggesting that this is going to be a permanent solution at all. We're talking now about the most cutting edge technologies that are available in hair restoration surgery. So we have a lot of questions that are not totally answered. But it appears that we get a good, strong response, and that response appears to hang on for at least 16, 17 months, which is what I've been doing it. So, with that in mind, stay tuned, because we'll have more information about other new technologies that are coming available. One of the more exciting ones is our tissue banking, our hair banking of hair follicles for future use in young patients. We'll talk more about that later.